When taking Tylenol cold head congestion severe 5 mg, 325 mg, 200 mg tablet expectorants, it is important to carefully follow the directions on the package label. If you have any questions, it's best to consult your pharmacist. You can take this medication by mouth with or without food, typically every 4 to 6 hours as needed, or as directed by your doctor. It's important to drink plenty of fluids when using this medication, unless otherwise directed by your doctor. The fluid will help to loosen the mucus in your lungs. If you are using the liquid form of this medication, be sure to carefully measure the dose using a special measuring device or spoon. It's important not to use a household spoon, as you may not get the correct dose. If your liquid form is a suspension, be sure to shake the bottle well before each dose. The dosage of Tylenol cold head congestion severe 5 mg, 325 mg, 200 mg tablet expectorants is based on your age, medical condition, and how you respond to the treatment. It's important not to increase your dose, take it more often, or use it for a longer time than directed. Additionally, it's crucial not to give children medicines labeled only for adults. If your condition lasts for more than 1 week, gets worse, or occurs with a headache that doesn't go away, rash, or fever lasting more than 3 days, it's important to tell your doctor. These may be symptoms of a serious medical problem and should be checked by a doctor. Some common side effects of Tylenol cold head congestion severe may include upset stomach, nausea, dizziness, trouble sleeping, or nervousness. If any of these effects persist or worsen, it's important to talk to your doctor or pharmacist. It's important to seek medical help right away if you experience any serious side effects, such as mental/mood changes, fast or irregular heartbeat, or problems urinating. While a serious allergic reaction to this medication is rare, it's crucial to get medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed here. As for when to take Tylenol cold head congestion severe, it's best to follow the dosage instructions on the label or as directed by your doctor. Be sure to take it with a full glass of water, and do not take more than the recommended dosage. If you have any questions or concerns about when or how to take this medication, don't hesitate to consult your healthcare provider. Before taking this medication, it's important to talk to your doctor or pharmacist if you have any allergies or any of the following health problems: breathing problems, diabetes, glaucoma, heart problems, high blood pressure, liver disease, overactive thyroid, or urination problems. This medication may make you dizzy, so it's important to avoid alcohol or marijuana while taking it. It's also important to be cautious if you have diabetes, alcohol dependence, liver disease, phenylketonuria, or any other condition that requires you to limit certain substances in your diet. If you're planning to have surgery, make sure to inform your doctor or dentist about all the products you're using, including prescription drugs, non-prescription drugs, and herbal products. It's also important to note that infants, children, and older adults may be more sensitive to the side effects of this medication. If you're pregnant, only use this medication if clearly needed and discuss the risks and benefits with your doctor. If you're breastfeeding, consult your doctor before using this medication. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. This medication may interact with products such as ketoconazole and levoketoconazole. Additionally, taking MAO inhibitors with this medication could cause a serious and possibly fatal drug interaction. It's important to avoid taking MAO inhibitors during treatment with this medication, and most MAO inhibitors should also not be taken for 2 weeks before treatment with this medication. It's important to speak with your doctor about when to start or stop taking this medication. The ingredients in this product are available in many prescription and non-prescription products, so it's important to check the labels on all your medicines to ensure you're not taking the same or similar ingredients. Using these drugs along with this product could increase side effects, so it's important to ask your pharmacist about using those products safely. Additionally, this medication may interfere with certain lab tests, potentially causing false results. It's important to make sure lab personnel and all your doctors know that you use this drug. If you suspect someone has taken too much of this medication and is experiencing serious symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact your local poison control center right away. In the US, you can reach the Poison Control Center at 1-800-222-1222. Canadian residents should call their provincial poison control center. Symptoms of an overdose may include a fast or irregular heartbeat, nausea, vomiting, loss of appetite, sweating, stomach pain, extreme tiredness, yellowing of the eyes and skin, dark urine, hallucinations, and seizures. Make sure to keep up with all your medical appointments and any lab tests that your doctor recommends. This will help ensure that you are getting the most benefit from this medication and that it is working effectively for you. If you are taking this medication regularly and forget a dose, take it as soon as you remember. If it's close to your next dose, just skip the missed one. Take your next dose as usual. Don't take a double dose to make up for the missed one. It's not necessary. When storing Tylenol cold head congestion severe 5 mg, 325 mg, 200 mg tablet expectorants, make sure to keep it at room temperature and away from light and moisture. It's important to keep it out of the reach of children and pets. When it comes time to dispose of the product, be sure to do so properly by consulting your pharmacist or local waste disposal company. Avoid flushing it down the toilet or pouring it into a drain unless specifically instructed to do so. And remember to dispose of it when it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.